Okay, we'll give everybody a few minutes before we get started. Good morning. We're just waiting for everybody to log on. We'll get started shortly. Okay, it looks like it's slowing down. It started in just a second. Okay. Go ahead and get started. Hello and welcome to the NEHA FDA RFFM Grant Program Q&A webinar. This will be a final opportunity for you to ask any questions before the application cycle ends and the grant portal closes on October 12th. But before we dive in, we have a few housekeeping items to take care of. One, the Retail Food Safety Regulatory Training Needs Assessment Survey. We ask each and every one of you, if you've not already done so, to take just 10 minutes out of your day to provide your feedback for this national census of resources and training for the profession of retail food safety regulation. The outcomes of this survey will be made public and help bolster educational resources and improve workforce capabilities for years to come. We're collecting as many responses as possible to gain the most accurate and representative workforce data, and we appreciate your contribution. The link to the survey can be found in the chat box. Jacqueline will put it in there for us. Number two, the NEHA Annual Education Conference call for abstracts. If you were funded under the NEHA FDA RFFM grant program in 2022 and plan to attend the NEHA 2023 AEC taking place in New Orleans from July 31st to August 3rd, we ask you to submit an abstract detailing your grant experience by October 14th. Please select the NEHA FDA RFFM topic track when you're submitting. Your abstracts can include projects in which funding was used, best practices, maybe a success story, or challenges that you may have faced. Lastly, please place any questions in the chat box, not in the QA chat, and feel free to ask any questions throughout the presentation, and we'll work to answer them at the end. Again, please place your questions in the regular chat box, not in the QA chat. So with all of that being said, I'll turn it over to Art Johnston to talk about why we're all here, the NEHA FDA RFFM grant program. Art?
Yeah, and some of you probably have been to our past webinars. We are just going to very briefly cover the basic information pretty quickly. A version of this PowerPoint is already on the website. We'll probably get this one up there as well, particularly if you want to look at this abstract information. And we would love to have a few of you give presentations at that annual meeting at the end of July, beginning of August next year. So we're hoping a few of you in the next couple of weeks get that taken care of, but this will be posted on the website. But what is the same for year two? Registration is the same. If you have a login already to a grant portal, if you've got an existing grant, or if you even applied last year, you can use your same login and password. You don't have to re-register. There also is a password recovery reset. So as long as you know what email you would have used last year, you'll be able to recover and reset that information. At the end of this presentation, we'll have our support team information, our web address, our email address, our phone number. You can always call us. But again, a lot of this is self-serve on the NEHA website. Mike Turner in a minute is going to walk you through quickly the website. Most grant program rules have not changed, so it's pretty much standard like last year. And retail program standards enrollment is still required for any of these grants. So that's what's the same. What is different? There are no new 3-year grants. So there are actually 5 different types of 1-year grants. And so if you don't have a 3-year base grant already, you're going to start with an improved track 1 or a track 2 development base grant application. We opened on August 17. You're going to have through October 12. So 2 weeks from today, You've got 2 more weeks to apply. And if you haven't started yet, that is plenty of time to put an application together. It's a simple process. Honestly, you can get that done in a day. So there is plenty of time if you're still thinking about applying. And all of these grants are 1-year grants with a full year performance period. You will get a grant notice in the early weeks, probably the first week of December. You'll know if you're awarded, what grants you have won, what grants you did not win. And then for the ones that you were awarded, you will have a full year to complete those grants. Will it be easier to apply than in year 1? We hope so. And we're hearing from people, it absolutely is. I think we already have somewhere around 150 applications already submitted through the portal. So a lot of people are getting in there, particularly the base grants. The track 1 base grant for people new to the program or restarting is really simple. It's a one-stop shop. You can do a number of different things through that track 1 grant. And it's the only grant you have to put in if you're going for track 1. Track 2 is also simplified, and you've got those additional options. And if you have a track 3 grant, you'll have additional options. We'll talk about that in a second. So track 1, you have to complete an SA9 and a CSIP, both of those in 1 year. Or if you've already done the SA9 with a grant last year or without a grant, you can just do a CSIP and you get up to $5,000 to do that. That's plenty of time. And most people find that that's really easy to do those hand in glove, the SA9 and the CSIP together. So reach out if you have questions to the grant support team on that. In track 1, you also have the option to request to be a mentee. You can click on a yes, I want to be a mentee, fill out a few additional fields. You don't have to go to another grant application. It's all in one. You also have the option to request funding to attend a face-to-face self-assessment and verification audit workshop. So all together with one application, if you're new, you can get up to $26,500 in funding. You do have to do the required outcome. You've got to be working on an SA9 and a CSIP or a CSIP, but you can choose neither of the optional outcomes, one, the other, or both. And in the applications coming in, I'm seeing that people are doing everything. There's people that are just doing the required outcome and asking for $5,000. There's people asking for everything and getting $26,500, and people in the middle. So again, for track 1, things are much simpler than they were last year. For track 2, you are required to do some work on standards 1 through 8. So, you know, if you want to work on standard 9, I've had questions. I just want to work on standard 9. The answer is you really, to be in a base grant, you've got to be working on 1 to 8. Doesn't mean you've got to meet any of those, but you've got to be moving forward with standards 1 to 8. And then for standard 9, we've got a number of different options. We know standard 9 can take a long time to meet. And we know there are different steps along the way. For some people, that's a 5-year cycle. And we've got 4 different options of the different steps. So if you have not started standard 9, you can get an additional $5,000 to start. And we are seeing a lot of applicants in track 2 who are doing that. So again, and also if you apply in track 1, you have the ability to apply for any or all of the 3 optional add-ons, and I'll walk through those in a minute. So track 1, one-stop shop. Track 2, you can apply for that base grant and up to 3 more grants. So you might be putting in 4 grant applications. So for those of you who currently have an open track 3 maintenance and advancement base grant, make sure you're keeping up to speed and doing the work that you said you do. If you're behind, that's okay. Hopefully you've told us that in the interim report, but if you need to make any adjustments, you know, hey, I'm going to do less in year 1, more in year 2, that's perfectly okay. Just reach out to the grant support team. We'll mark that in your grant, and that's going to tell us, even if you're behind, that's telling us, yeah, you're on it. You've got a plan. You're going to get that done. And as long as you're in good shape there, you are going to have that option to apply for any or all of the optional 3 add-ons. You are not allowed to apply for a second base grant. You can only have 1 base grant at a time, whether track 1, track 2, or track 3. But if you've got that open track 3 maintenance and advancement base grant, you can apply for any or all of the 3 optional add-ons: the training, the mentorship, and the special projects. And so for those track 2 applicants, if you're putting in a track 2 application, or if you've got a track 3 base grant, you can put in a mentorship application, and you can be either a mentee in any given year or a mentor. And we're really hoping, we're actually seeing a lot of mentor applications. We love that. You can be a mentor if you're willing to work, if you know standards 2, 3, and 5, and you want to help people on just those standards, you can do that. If you just went through your self-assessment of all 9 standards and you just did your CSIP and you're really good at that, you can put in to be a mentor just for that, to help some of those newbies really get on board, or anything in between. If you're an expert in everything, you can be an expert in everything. You can have 1 to 5 mentees based on what you feel like you can do. But again, you get more money, 24,000 for 5 mentees. I think if you want 1 mentee, it starts at a maximum of 12,000. To be a mentee, you get up to $14,000. So if you're doing some work in a base grant and you want some help and you feel like you need some more funds, trying to get a mentee grant is a great way to do that. So you can also get a training grant if you're in track 2 or track 3, and again, up to $7,500 for training. And then you can also go for a special project, which, and again, this is really, I should have updated this slide, but it's not about retail program standards as much. The special projects is really about the integrated food safety system, and you can ask for up to $20,000. And make sure you read the grant guidance really carefully read that grant guidance, because this is a very competitive grant. You definitely, if you're going to put in the work to put this in, you want to make sure you're aiming to build the integrated food safety system, and particularly that you're ready to do something that maybe will help other jurisdictions move forward. Maybe you're creating something that can be shared. Maybe you're doing outreach in your state to help other jurisdictions, but those are the kind of projects that are likely to get funded, focused on the integrated food safety system, and really aimed at helping the whole team grow together. So a little bit on that. And then we just want to, before we get into Q&A, we're almost done with the presentation part, but we're going to have Mike Turner walk you through the website. And there's a whole lot there. There's a whole lot of things that you can self-serve and get a lot of information. So we just want to remind you where those things are at. So I'm going to stop sharing, and Mike's going to take over and walk you through the NEHA, the NEHA Retail Standards website.
Yeah, thanks, Art and Joetta, and good afternoon all. Many common names and faces that we've seen before with the previous years of grants, and several new folks as well. A quick reminder, been asked by the NEHA team that if you have a question, and again, we'll dedicate and reserve plenty of time at the end here to any questions that you have, but go ahead and include those in the Q&A option at the bottom of your Zoom toolbar there. Use the Q&A instead of the chat feature. All right, so looking at the main website here, I just want to highlight a couple of things that you can navigate to, really self-service information. And in a moment, we'll provide, if you can't find it here, then call us or email us. We'll provide that information here in just a moment. But for right now, go ahead and bookmark neha.org/retail grants. This is a homepage really providing the high-level information that we need in the final 2 weeks of the open application period, including those key dates and some highlights of the program. Kind of the most important part, though, is really navigating over to this left-hand menu. And from here, several important points. First, the grant guidance, probably the very first stop that you want to look at. Make sure you download this grant guidance. It will answer so many of your questions right here. We have the old grant guidance from the previous year of this, the calendar year 2022. Where you want to look is either this PDF document, or we have a digital flipbook as well that's really helpful and easy to navigate. So, searching for those, you have all of the program details, including the different tracks that are available, allowable, non-allowable costs, and a great deal of information as it pertains to reporting as well. From there, also, if you scroll down on that left menu, you'll see application templates. Now, if you have a current username and password to the grant portal, you can use that. You can log in and you can click on any of those apply now buttons to see in real time the actual application. But if you just want a quick reference, if you want to download and get an idea for how these applications look and feel, simply click on application templates on the left-hand menu, and you'll have the different tracks and optional add-ons broken out here. We've also included some budget examples, which again, just kind of highlight what we're looking for and how this will actually look once you insert all of your information into the grant portal. So again, use those resources as you'd like and as they serve you throughout the application process. An additional stop also on the left-hand menu, program resources, and several important points here. First off, that very first, our partners at the U.S. Food and Drug Administration really providing the funding and the opportunity for these grants. Several links here, including what are the retail program standards? If you are just entering the retail program standards, what does that mean? How do you enroll? Who do you contact at the FDA? There's a tremendous resource in the retail food specialists that are located throughout the country, and there's certainly one that's assigned to your jurisdiction. You can contact them there. We also have information for if you need to complete a comprehensive strategic improvement plan. We have instructions there, and the same for the public health metric. We've included some guidance. So if you need to do a CSIP or a public health metric, we have step-by-step instructions and details on how to do that. And then we also, as we get into calendar year 2023, some information about eligible training options, as well as FDA's training calendar and catalog, all available direct from the neha.org/retail grants website. And the very last thing, while this webinar will probably go online here really soon as well, we have done more comprehensive webinars. So if you wish to access any of those downloads, those are available here as well from the kickoff on August 3rd. So with that, again, if you have questions, feel free to include those in the Q&A section using the Zoom toolbar at the bottom. For now, though, Art, I'll turn it back to you.
Yeah, and the one thing Mike didn't show you, and we'll have it in the PowerPoint here as well, but on that main RFFM retail grants page, if you scroll down to the very bottom, you're going to see the contact information for the grant program support team. So, and we'll also have that at the end of this PowerPoint here. But let's throw it over now, we close on October 12th, so you've got 2 weeks, and I think Joe's going to walk us through the Q&A period.
Joe, you're muted.
Yes, I just realized that. I apologize. We've got a lot of questions here. We've got some good questions. So Art, I'll just go ahead and start with them. The first one is, can we work on one standard out of the 8 under track 2?
Answer is yes, you absolutely can just work on one standard. This program is designed for you to work at the pace that works for your organization. So absolutely.
Okay. And then we have, is it okay to have one program lead? The question, oops, it's scrolling down on me. The question allows for a lot of characters, but we've pretty much got one person running this.
Yeah, absolutely. You're not going to be penalized if you've got a project that really just needs one lead. Make sure, you'll know, you probably already know there's multiple fields where you put different information, but just because the characters are there, you don't have to use them all. Just put in the complete information, answer the question fully, make sure you're providing qualifications where asked and titles and all that, and you're good to go.
Okay, I think this one's more for Tiara, but anybody can jump in. How are you pairing mentor and mentees? Do you need information from us to help? Things like town size, number of establishments, etc.
Yeah, Tiara, why don't you lead on that, and I can add if anything else needs to be added.
Sure, thank you. So typically the first thing that we match mentors and mentees on is based on the standards that the mentee would like to work on, and we match that with the expertise of the mentor. And beyond that, we absolutely pair folks based on or we can match folks based on jurisdiction size, based on number of retail establishments that the jurisdiction has, et cetera. So there is a part in the application where you can put, if you have a preference on those things, if you would prefer to work with if a mentee would prefer to work with a mentor who is closer to them, or, you know, in the same region, or is the same size, or has the same government structure. You can write that as a preference. We may not be able to pair based on that, but we absolutely try our best to acknowledge those preferences.
Yeah, and the only thing I would add is we do ask population and number of establishments. We ask that of both mentors and mentees. Both mentors and mentees have the option to say, hey, I would like to work with this jurisdiction. So if you have a mentor that wants you, you can both put in that preference. Again, no guarantees, but you could also put in a preference not for a specific mentor, but say, I really would like to want a small jurisdiction that's like mine. You could put that as well, and we will do our very best to honor. And when I say we, I mean Tiara and her team and NEHA, but they'll do their very best to really honor everything you want. But bottom line, I don't think we've ever had people really disappointed with those pairs. I mean, we really do work very hard to get you what you want and what you need.
Okay, great. We have another mentorship question. I don't know who needs to answer this one specifically. Is mileage acceptable if we have a close-ish mentor and want to visit more than once?
And Tiara, I can probably answer that. Yeah, absolutely. Mileage is totally fine, and multiple visits are fine. And I'll say this too, because you might ask for somebody close by, but for whatever reason, there is a chance that maybe the perfect mentor is a plane flight away instead. You will, as much as you're putting in all the details of what you think your plan is right now, you are going to have a chance to update both your plan and your budget if your mentor ends up being different than what you expect. So put your full plans in, what you want and what you think you need, knowing that that can be adjusted. But absolutely, mileage is acceptable, but so is so is other travel costs are too if you end up having a further away mentor.
Okay, so here's one on track 3 grants. So if you have an open track 3 grant outside of the normal report, is there anything that needs to be submitted in this process for the base grant for the upcoming funding years?
I feel free to re-ask if I'm misunderstanding part of this. I'm a little confused with part of it, but you don't have to do any. If you've got an open track 3 grant, we're going to know that during our administrative review. So all you need to do is put in your optional, whatever optional, up to 3 optional grants. That's all you need to do. Now, I will say everybody has turned in their interim report. So if you have any further updates that you want us to know about, that's fine. But bottom line, if you've got an open track 3, you're going to check the box, and we're just going to have your grants reviewed as eligible, under the 3 optional add-ons and any of those 3 that you submit.
Okay, great. How do we estimate costs for attendance at the NEHA AEC registration and lodging, for example?
What I would say, I mean, we know where not only the NEHA AEC, but I think NACHO's got theirs planned out. That's on the website. I know Afto does as well. So what I would say is you generally can estimate what your flight costs are going to be, what your driving costs are going to be, what the hotel costs are going to be based on past history. I would say, obviously you can utilize less than you were awarded, but you can never ask for more. So you're really better off aiming a little bit higher in terms of your budget. I would say for most AECs, I think, depending on what city you're flying, like I'm from Tallahassee, so I would probably plan on $800 for a flight. If I lived in Raleigh, I'd probably plan for $400. You can fly cheaply from Raleigh just about anywhere, but your area. Estimate a flight on the higher end. I usually would use as a thumbnail $200 a night for a hotel, but again, that's going to be dependent on cities and things like that. Tiara, is there anything you would add to that, thinking about the NACHO conference?
No, I would probably reiterate what you said. I think
Yeah.
that's about right. Mhm.
And you can get the per diem rates. They won't change much from 22 to 23. So you can look at the 22 per diem rates and, again, just put on a realistic estimate of your travel costs, add 10%, in the different categories to maybe be a little buffer, but that's probably the best thing to do.
Okay, will there be a registration fee for the virtual self-assessment and verification audit workshop option?
I love when people ask questions that I planned on addressing and forgot. This year, there is no registration fee for the virtual seminars. They're going to be free. So unless you want to go to a face-to-face, you don't need to add that virtual seminar to your grant applications. They are all going to be free for 2023, which is a nice thing. I think FDA is really working hard to make sure everybody can get in there. We know a lot of you tried to get into the face-to-face and the virtual in 2022, could not. We're going to work even harder to get everybody in there. We're also going to be a lot more pointed on, if you were funded through this program for a face-to-face, we're going to really try to make sure you get into a face-to-face. So don't be afraid, just because you tried last year and failed to get in, don't be afraid to try again this year.
Okay, thank you, Art. For the mentor grant, would that cover personnel costs for people going to the end of year mentorship conference in addition to the travel expenses?
Tiara, you want to get that, or you want me to handle that?
Sure. Art, you can correct me if I'm wrong, but I believe personnel expenses are covered in the grant, along with travel.
Yep. Yeah, that's absolutely right. And unlike this year, where we had two different funding sources for that end of year conference, for 2023, both of those are going to come through your grant. So make sure, if you want to send, and you can send no more than 2, but up to 2. So if you want to send 2 people, you can include personnel costs for both of those people, and you can also include the travel cost in your optional add-on grant.
Okay. And then we have just a simple CSIP template question mark. So I know those are available on our website, the CSIP template.
Yeah, if you go under program resources, that's where you'll find it. I think where people get lost is they might be looking for a one-page template, but it really is that it's that toolkit where it's a multi-page, multi-tabbed. Am I right on that, Joe? It's the multi-tabbed spreadsheet they work through to fill out their CSIP.
It's an actual just CSIP template. Yes, it's multi-page. I haven't looked at the Excel version of it.
Okay.
I've seen the Word version of it.
Okay. And I might be wrong. I might be thinking of the self-assessment of all 9 standards where you use the Excel workbook.
Yeah,
but yeah, there are templates there. They're under program resources. If you have any trouble finding those, reach out to us at retailgrants@neha.org or the phone number, and we'll walk you through and get you there.
Yep. And what you were speaking about, the Excel spreadsheet with all the tabs, is for the SA9, the one that fills in
all 9 standards.
Yeah. All right. If our SA9 is due October 2023, we can apply for track 1, correct? I'm not the staff member who completed the SA9 the first year. So how do we budget for this?
Yeah, I'm looking at the question. To apply for track 1, all you need to be is enrolled if you want to work on your SA9 and your CSIP. But if you've got a grant during this year and your SA9 is not done yet, you can still apply for track 1 for a CSIP. Totally fine. We're just going to we're going to make a note of that in your grant. You'll get your year 2 grant. You'll get your CY 2023 grant. The only thing is you won't be able to get any money on your CY 2023 grant until you finished your CY 2022 grant. So just keep that in the back of your mind. But I know a lot of people with a CY 2022 grant, they're going to finish up their grant by December, and then they're going to pick up on their CY 2023 grant. That's completely okay. And we'll be working with you to make sure everything gets completed in a timely manner. If I didn't fully answer that question, please add another one. I'll be more clear.
Okay. I have completed our CSIP. Well, congratulations. And where or who do we send it to?
And that's an interesting question. The CSIP really is for your own use. You don't really need to send it to anybody, with one caveat. You do need to attach it for a track 2 base grant. Even if you're and let me give you another example. Let's say you have a track 1 grant right now to finish your CSIP, but you're not quite done and you've got till December to finish that. Just put whatever state it's in and say, we're not quite done. We've got a year 1 grant. We're working on it. Put the partially completed CSIP on your track 2 application. That's going to be perfectly sufficient, but that's the only place you've got to turn in your CSIP. We're not even really reviewing that. We just want to verify that you've done it. And the CSIP is a planning tool. It's a multi-year planning tool for your work through the standards. So that's what that's all about. And Joe, I saw we missed a couple questions about reserving lodging above GSA rates. If your agency does not let you go above GSA, what I would suggest is look at the area, ask for the GSA rate, and then you might not be able to go to the conference hotel. Oftentimes they will get it under the GSA rate, but you might just have to find a nearby hotel at the GSA rate. And the same would be for that mentorship meeting at the end of the year. That's how I would handle that, those 2 questions.
Okay, great. Let's see. We have a couple of questions on if we apply for track 1 optional outcome. For track 1 optional outcome 2 SAVA workshop. 1, if we apply for, I'm having a hard time with this, I'm sorry. If we apply for funding, but something happens and we can't go, loss of staff, etc., what happens? We'll do that one first.
And I can hit all of these because they're all really related,
Okay,
Joe.
great.
If you go into track 1 and you pick optional outcome 2, I want to go to a face-to-face workshop. If nobody goes, that's fine. You just won't get to utilize that funding. You'll just lose whatever, you just won't get reimbursement because you didn't spend any money. You absolutely go ahead and put a name of who you think's going to go, or if you've got a to be filled position, name the position and say, when we fill it, this person's going to go. But you absolutely can make substitutions. We're just going to make sure that it's the right person to go. It's going to be frowned on if you say you were going to send the lead of your standards program, but instead you send the administrator from your office. But if someone needs to go, you can sub names and just explain why and why they're the right person to go. I'm also seeing, do you get reimbursement after travel, and is it for all the funding in the workshop? And there's also a question about in-person and virtual. Again, no cost for virtual, so you don't have to put that in, but for in-person, you can get that either as reimbursement, or you can get an advance for that if you need it. If you need the money in advance, you can get an advance for that, those travel costs. All we ask is when you're getting advances for travel costs, aim a little bit low, because you don't want to get too much money, and you can always put in for the plane in the hotel and maybe get the per diem afterwards or something like that. But when for planning purposes, you want to put a little extra on your training requests. But when you're getting an advance, you want to go a little low just so you don't have to return funds. If you work for a government agency and you've ever had to return funds, it's not always easy, takes a lot of effort. So you want to avoid that. But absolutely, reimbursement's fine, and advance is as well. And this is an important question. Does this funding cover the staff's hourly rate to attend the conference? The answer to that is no. Personnel costs are okay for all grant types except training. Training, you just get the travel, not the personnel time. That's the only grant type that does not allow personnel time. And how that applies for a track 1 grant is you can have personnel costs in your required outcome of a track 1 grant. You can have personnel costs in your mentee part of a track 1 grant, but the training part should only be travel costs. Hopefully that's clear.
Okay. What is the deadline for progress reports for the current year?
All right. I can happily say that you've all met your deadline for your interim progress report, so you're good to go on that. Your final progress report is due 45 days after the end of the grant period. So technically that's about mid-February of 2023. But as soon as you're done with your grant, we'd love you to get that in. And we're not going to give you your final reimbursement until that's ready anyways. So again, the latest possible date is February of 2023, mid-February 2023. But whenever you're done, go ahead and do a final reimbursement report, do a final progress report, close that out, and you'll be good to go.
Okay. We have for track two, for standard one, if we are unable to predict a completion date, what date do we put? Is ongoing an acceptable date, or does it have to be a predicted date? Thank you.
If you don't know when you're going to, if you're applying for track two and you're not sure when you're going to be done, just put December 31st, 2023. Just give yourself that whole year. That way you've got the whole year. You can always turn it in early.
Okay, then we have thanks for the Mentee info, but where are these questions after we receive funding? It's not clear in the application, and then it says base one.
Thanks for the if you're in a track one application, if you select, there's an option that's going to say, and I believe it's option one, it's going to say, do you want to be a mentee? If you check yes, it should open up a whole bunch of fields that you can fill out. Yeah, and if you have any trouble with that, please reach out to the grants team. But there are quite a number of fields that should open up when you say, yes, I want to be a mentee, and a lesser number of fields that open up when you say, yes, I want to go to a face-to-face SAVA workshop.
Okay. What if you do not spend the budgeted money in the year?
If you do not spend all your money, but you finish your project, you will not get reimbursed. You will lose that money. You can't kind of switch it to another use. But the good news on that is it's not like that money goes away. What NEHA gets to do is add that to the pot for the year two grants, and in year two for the year three grants. So it's a wonderful thing. If you thought if you were going to meet two standards and you met them both, but you only spent half the money that you said, just go ahead, close out your grant. You won't get that extra money, but it will help you and others in years 2 and 3. I hope I answered that correctly. If not, reach out for additional clarification.
All right, when we submit our budget, do we need to attach supporting documents for equipment? For example, do we need to send in screenshots of exact equipment price that's listed on the website we would purchase it from, or is simply writing it into our budget sufficient?
Yeah, you do not and I want to be really clear here. We're talking about an application here. Fill out the budget worksheet with your best estimates, fill out the justification to give us those details. But no, we do not need screenshots, no documentation, nothing like that. We're trusting, that's the most you're going to get. Now, I will say this, we are going to ask receipts before we pay you. So, you might want to add a little higher than what your quotes are in case they go a little higher. But when you ask for a reimbursement, that's when you have to put in all that kind of documentation.
Okay. Apologies that this question is jumbled. I hit enter before I was ready to send. My question was, what flexibility do we have if we apply for the track one optional outcome to self-assessment verification audit workshop in the event we cannot attend? Because track one is only eligible to go to that workshop, that's the only training eligible, you just would lose the funding. So if you end up not being able to attend, you would just lose that portion of the funding, not your required outcome funding, nor your mentee funding if you pick that option. You would just lose the training portion. All right, follow up, since this is our first year applying as a mentor. So Tiara, this one's for you. I think I read the NEHA conference is a 3-day conference. Is that correct?
Yeah, if you're referring to the end of year meeting for the mentorship program, yes. So that is the 2.5-day meeting. We aim to make that the best networking and learning experience for mentors and mentees. And in that 2.5 days, there are presentations that are standard specific. Also, there are presentations from mentors and mentees on the work that they were able to complete and accomplish throughout the year. So yes, if you're referring to the end of year meeting, if you're referring to the NEHA conference, NEHA annual, which is in Denver next summer, I believe the dates for that are July 9th through the 13th. So a little more than 3 days.
And I would just add that it's probably, I know this is true for this year, but the end of year meeting, it's a travel day on the front end and then 2.5 days of conference, and then you fly home in the afternoon. So it's, for most people, it's a 4-day trip. Two travel days and 2 solid days in the middle.
Correct.
Right. Our older SA9 expired in August of 2017. So right on the line, assuming we can apply for a track 1 base grant to redo, update, and also do the CSIP.
You absolutely can do that. Yep. If you're right on the line there, even really any time, if your self-assessment of all 9 standards applied anytime during 2017 and you wanted to redo that and also do the CSIP, you could pick that option as a track 1 grantee. Absolutely. Okay.
And then we have, what is the registration fee for the in-person SAVA workshop?
I believe it is on the website. Mike, if you can look that up, and I know there are 2 different. There's one of the pre-planned face-to-face is attached to the NEHA conference once again. One is attached to the Afto annual conference, and I think there's a $25 difference between the one and the other. Mike, do you see that? And I want to say it's in the $150 neighborhood.
Yeah, I'm still looking at it. I'll include that link in chat.
Okay, great.
Great, thank you. To clarify, our SA9 was completed and due again in 2023. Our CSIP is being worked on right now for the 2022 grant. Can we apply for the track 1 grant for 2023 to complete this?
I'd have to look, and feel free to reach out by phone or by email to the grants team. But with this additional information, if you've got a grant to do the CSIP in 2022, you really should be applying in track 2. And then you could update your SA9 as part of that track 2 grant. But Amber, definitely reach out and we'll look at your grants with you and make sure we're answering that correctly. But the goal really is to keep people in track 1 only for 1 or at most 2 years and get you into track 2 and get you moving forward on some of the other standards. So Amber, what it's really going to depend on is, did you get that year, the COI 22 grant, was it to do an SA9 or was it to do a CSIP? If it was to do a CSIP, you might get scored low by staying in track 1, but feel free to call and talk if you have specific questions on that.
Okay. We'll be conducting the follow-up to our risk factor study from 4 years ago. Are we able to apply for funding under track 2 towards that? We'll be working on getting 3 other standards audited as well.
Absolutely. You'll go ahead and under the required outcomes, you'll put in those 3 other standards. And then under the public health metric option, you've got 4 different choices, which should cover the gamut of what's needed. But whatever you want to work on, select 1 or more of those choices and tell us exactly what you're going to do.
Okay. If we have multiple staff members helping with a project, do we need to list out each individual staff member's salary in the budget?
Yeah, you probably should at least have a thumbnail of how you're going to calculate, the hours you're charging to the grant. And when it comes time for reimbursement, it's less important in the application, but when it comes time for reimbursement, anybody who's charged to the grant, we're going to want to see proof of their salary and proof that they actually worked on the project with timesheets and things like that. So, less important in the application, but definitely you're going to need that later. So you might want to do some of that math up front.
Okay, lots of really good questions.
Yeah, really, really good questions.
Yeah, in depth too. Under project information, the application asks for team qualifications. How in depth should this be?
You don't need, it's not like you're going to apply for a grants.gov grant and you need a bio sketch for each person. Just enough. I think the average person probably puts the name, the title, what they're going to do for the project, and then a little bit about their qualifications, what they do for your department, what their past experiences was. But normally I think we're probably talking a paragraph or two per person, not a page or two per person.
Okay. And then we have it is using a consultant to help with our SA9 and approved cost.
It absolutely is.
Good news. How detailed should a budget be for the track 1 required outcome?
You've got $5,000 for that required outcome. Just so how you think you're going to spend that money. If it's all going to be personnel time and it's going to be one person, you can put that in. If it's going to be personnel and it's 2-person, kind of split that up a little bit in your budget justification. Like we talked about a minute ago, put in maybe the calculations on how you come up with that. If you've got supplies and personnel and some equipment costs, you can put that in. But again, give us your best idea of how you're going to spend that money. Give us some detail so we have a good sense, and particularly the peer reviewers have a good sense of that, what needs to be done and what you're doing. But keep in mind, you are allowed to make budget changes. If you end up thinking that it was going to be a 1-person job, but then you ended up having 2 people work on it, you're going to be allowed to make that change. If you thought you were going to need equipment and supplies, but you ended up really spending a lot of personnel time instead, you can change it that way too. So most people have a budget that is primarily focused on the personnel time it's going to take to do the work, but we absolutely see supplies and equipment and contracting costs and things like that in there as well.
Okay, great. Now we have questions that actually were able to make it into the chat.
All right.
So, let's see. I believe we answered this one already. What is the deadline for progress reports for the current year?
We got that one.
Yep. Okay. The application asks for the location and dates of the FDA Southeast seminar, which have not been released yet. How do we fill out this field on the application?
You will not be penalized for putting TBD, to be determined. And then what you're going to have to, obviously, cost is a question. So you're just going to have to estimate based on, I don't believe any of that information is going to be released before October 12. So put in as much as do the estimates as best you can. And remember that you can't ask for more money later. So, for when there's so many unknowns, you might ask for a little bit on the high end for those travel costs.
Okay. And Tara, this one definitely goes to you. How would you know when your mentor will be mentoring? Is this an internal conversation with the mentor once approved to schedule time?
Thank you. And yes, so when you are paired and you receive that notification of when mentors receive the notification of who their mentees are and mentees receive the notification of who their mentors are, we make sure that contact information is exchanged or received for both parties. And typically the mentor will reach out to the mentee and begin scheduling any check-in calls that need to happen throughout the project year. And during those discussions too, that's when the work plan is settled. So that when you all submit the work plan for the project year, one of the first things that you have to do when mentees and mentors connect is to review that work plan and decide if it's feasible, and to make sure that each other are aware of the steps that you will take throughout the year. So that that communication begins almost right away when the pairing happens. And in that time, you discuss with your mentor and mentee when you will be meeting throughout the year. So yes.
Outstanding. Thank you.
And Tiara, let me just add to that is, we know particularly in the mentorship and the training applications, we know sometimes you're just having to project, and not only do we allow those updates to your mentorship plan, We expect them. Pretty much everybody updates their budget and their plan. But for a peer reviewer to really know that you're serious about this work, we do need you to put in that initial plan.
Right. Okay. Do you need to apply for the training grant each year?
Yeah, Nelva, great question. And the answer is yes. Some of the grants are 3-year grants. So obviously you don't need to apply for those every year. Some of them are 1 year, but they can be extended. Like a track 1 grant from year 1 could be extended if you really needed it. But training grants are always 1-year grants and they can never be extended. So they're kind of use it or lose it grants. And we know that a lot of you who got training grants in year 1 weren't able to use it because of the pandemic, and so many trainings were converted to face-to-face. I mean, from face-to-face to virtual, and there weren't costs or very low costs. We don't expect that as much in 2023, but you never know. But they really are 1-year grants that need to be, you're starting from scratch every year with your new needs.
All right. Is there anything we should consider in the budget if we're working on standard 3?
And Joe, do you have any, I have a generic answer to that, but do you have any advice for that one?
I don't know.
Okay. Couple things. One, for most of the standards, the primary cost is normally personnel costs, just the time spent doing the work. So that's what most people put in. I would say if you want more specifics, the best person to ask that would probably be your retail specialist. And you can get the name and phone number and email of your retail specialists on the program resources left tab of the NEHA website. Sometimes they travel and they're not always able to respond right away. So you can also put this in through the NEHA site to the program support team, and we'll get you connected with a member of the advisory team that can probably talk to you about that a little bit. But the best person to give you more details really would be your retail specialist.
And your retail specialist is always an outstanding asset for anything to do with the retail programs.
Yep.
Anytime. Okay. Can we use training grant for membership fees or get licensures or certifications for staff? Examples: NEHA membership, Afto membership, Cfpm, and Rehs.
The answer is no with an asterisk. Membership fees are never permissible, even if you can be a member and it lowers your travel fees. That's still not allowable. So we don't pay membership fees for anything. We don't pay licensures or certifications, nor exam fees, but we do pay for training and for resources for some of those. Like I'm thinking of the certified proof professional. You can pay for the course, you can pay for the materials, the study materials. You just can't pay for the exam or the licensure. So check out, if you look at the grant guidance, that's outlined in non-allowable costs. Sometimes it gets tricky when you've got to sign up because it's all rolled together. So just reach out if you've got questions on that. But some of those certifications and licensure, some of the costs are covered, some of them are not.
Okay. For track 2, for standard 1, if we are unable to predict a completion date, what date do we put? Is ongoing an acceptable date, or does it have to be a predicted date?
I think we covered that, which is your track 2 grant goes through December 31st, 2023. Just put that in.
Mm-hmm. All right. When we submit our budget, do we need to attach supporting documents for equipment? Oh, we answered that one already. We did that on the previous. We have some that are duplicates. I'm trying to catch them. Okay. I registered but have not yet enrolled in the standards. After reading further, I realized this was an error on my part. Once I have completed the self-assessment and submitted this, will I need to register again?
Tonya, not at all. Those can, even though they're both required, they can be done separately. Just make sure you get that enrollment in before October 12th. Better yet, get it in this week. And we do, when they're late like this, they don't show up on the public website. So we will be checking with FDA and we'll be checking with the retail specialists, and that's the person that's going to get your enrollment. But I'd get on that right away, but nope, your registration's fine. They can be done separately.
Okay, and then we have one more that came up over in the Q&A. When submitting documentation for time spent by staff, does this time need to be coded to a different expense code on time records, or can it be tracked separately on a spreadsheet?
We love accounting documents that are coded, but whatever you have, we will accept. When you ask for reimbursement for personnel time, you're just going to have some kind of document that shows the person listed was actually paid during the time period. And oftentimes that'll be an accounting run, something straight from the accounting records. But oftentimes we worked 30 hours on these dates. That's very often a spreadsheet. So it can be both and there, but just give us the most official documents you use. Make sure you're keeping careful records. And if we have any questions, we'll reach back out to you. But generally speaking, spreadsheets and accounting records are the best things.
All right. And then we have, is there guidance on reimbursement or requesting funds in advance for attending workshops?
There is on that left menu there. Mike, what is the name of that tab on the left menu?
Say again, Art.
What's the name of the tab, the reimbursement and advanced tab? The reimbursement.
Reporting and payments tab?
Yeah, look under on the left menu from the website, look under reporting and payments, and you'll have quite detailed information about asking for those advances and reimbursements. And again, we're always available through the phone or via email. Hey, let me jump back to Tanya's question for a second. For those of you who maybe didn't realize it, there are 2 steps if you're new. One is to enroll in the standards, and that's once and done. Once you do that you should be good forever. And then registration is once and done, and that's registration for the grant program. But they are 2 separate processes. One is done with FDA, one is done with NEHA. So if anybody else misunderstood that, make sure you get in there and do both those things. And we will be checking up on you. And you might, if you didn't do both of those, we might be giving you a phone call in the next week or 2, making sure you get both of those done.
Okay, I believe that's all the questions we have for the moment. So we only have a couple minutes left. So I'll go through and I've got a few more reminders for everybody. Art or Mike or Tiara, do you have anything you need to say before we wrap up?
We're here. If you need any support, don't get frustrated. Most of the information is on that neha.org/retail grants webpage, but hopefully you have this information as well. retailgrants@neha.org if you want to send us an email, or 833-575-2404. We have all of our team here ready to answer your questions. So please give us a call or shoot us an email. We're glad to help.
And I can say Art and Mike and their team do an absolutely amazing job with their work on the grant. They are on top of everything. And thank you, Tiara, as well. Tiara, do you have anything you need to add?
Similar to what Mike just said, if any of you have any questions regarding mentorship, please don't hesitate to reach out to the NEHA staff. If you don't have our contact information, feel free to reach out to Niha, and I'm sure they will direct your questions to us as well. Yes, so thank you so much, all.
All right. Okay, well, as a reminder, please take the Retail Food Safety Regulatory Training Needs Assessment Survey, and that's going into the chat box again. And if you wish, please submit an abstract to speak about your experience at the 2023 AEC in New Orleans. And again, that link is in the chat box as well. And the final reminder, the portal closes on October 12th at 7:59 p.m. Okay, and thank you for joining today, and a best of luck to all our applicants. Have a great day.
Thanks, everyone.
Thank you.